Okay, so we're going to finish up now with talking about different types of psychotherapy, talk therapies. The last two that we talked about, psychoanalytic, or last three, psychoanalytic, psychodynamic, and humanistic, are all considered to be what are called insight therapies, meaning their job is to give insight into your own thoughts, feelings, memories, whatnot. But with psychoanalysis, the therapist helps you reach those conclusions. With client-centered humanistic therapy, it is up to you to. They are just a guide to help you reach conclusions about yourself and help with your own personal growth. Now, around the same time as humanism, we get what we have talked about before, which is behaviorism. Behavioral therapies are first put forth by a woman named Mary Cover Jones. And as we know about the behaviorists, they do not care about thoughts, feelings, and whatnot, because those are subjective and they cannot be measured. All the behaviorists believe, like B.F. Skinner and John Watson, that psychology should be the science of observable behavior, i.e., actions. So, behavioral therapies are focused on changing behavior rather than changing. So they assume that abnormal behavior is a product of your own behaviors rather than memories. Sorry, my phone's ringing. Rather than memories, thoughts, feelings, whatnot. So with behavioral therapies, their focus is to change behavior. And the idea there is that once we change behavior, our thoughts and feelings about things, our emotions will change with it. An example of this is if somebody is racist, there has been the idea is to maybe get them to hang out and be nice to people of other races, and eventually their opinions about it should follow suit if their behavior is correct towards those different races. Both of these behavioral therapies use classical and operant conditioning techniques, but to lead to behavior modification. So we're going to break these down into two different categories. Classical conditioning techniques for behavioral therapies. Okay, as we know, classical conditioning is learning to associate two previously unrelated events or whatnot. So if we have an incorrect association, an association between two things that is causing us an issue, the idea there would be to, well, change the association. This is called counter conditioning. When we counter something, we do the opposite. There are two types of these classical conditioning therapies. One is called exposure therapy, and the other is called aversive therapy. Exposure therapies, the idea behind exposure therapies is, for the most part, these are focused on phobias and other anxiety related disorders. And what they want to do is, through the exposure to the anxiety causing source, and you learn to change your association, you change your feelings about it. Change it from something negative to something more positive. Systematic desensitization is the main way in which they go about doing this. And this is used mostly with phobias. The idea here is that through taking baby steps, through small incremental changes of changing the association, eventually the overall association will be changed from something maybe that you fear and causes you anxiety. That's something that you feel relaxed around. With systematic desensitization, we are slowly desensitizing the patient to the phobic stimulus. The first step here is what they do. They have the patient create what is called a hierarchy of fear. So we'll use my fear of frogs as the example. All right. If I say that I'm afraid of frogs, let's say I work at the zoo, all right, and I've been put in charge of the amphibian exhibit, which I'm going to be exposed to frogs all the time, and so I can't be afraid of frogs. So I have to get over this fear. The idea here is they have the patient first rank rank in order what would be with the phobic stimulus, what would cause the least amount of anxiety, going up step by step into what would cause the most amount of anxiety. All right, so we see here on the right side in the example, this would be my anxiety, my hierarchy of fear or hierarchy of anxiety. Thinking of frogs would probably be cause the least amount, going all the way up to being in a tub of frogs, which would cause me the most amount of fear and anxiety. After you create this hierarchy of fear, they then teach them relaxation techniques, breathing, and whatnot. And then what they do is they slowly start to expose the patient to each step of the hierarchy of fear while using the relaxation techniques. So they would say, all right, Billy, just think of frogs. Okay. And then as I'm thinking of frogs, all right, I use the relaxation techniques that they've taught me. So I start to change my association with it from being afraid to being relaxed, all the way up to finally, I'm just in a tub full of frogs and say, all right, breathe. And instead of being afraid, I am feeling more relaxed. So you can see how there's a step by step process, slowly desensitizing the patient to the fear inducing stimulus. Okay, by changing the association from being one of fear to being one of relaxation. What they use a lot now, instead of exposing them directly to the stimulus, because it's cheaper, because it's easier, because we have the technology, is what is called virtual reality exposure therapy. They can do this hierarchy of fear, but instead of exposing them directly to the stimulus, they can use VR goggles. So they have used this, for example, they might use this with fear of heights. Instead of exposing a patient directly, like bringing them up on top of a tall building, having them deal with it until they are no longer afraid, they can use VR and it's cheaper, right? It is in a safer setting and whatnot. So they're exposing them to the fear-inducing stimulus, but in a virtual reality setting rather than rather than making it tangible. This has been found to be really effective with PTSD, especially with veterans. They can expose them to combat situations without actually having to have them in combat again. So exposure therapies change the association from something negative to something positive. Aversive conditioning is when we want somebody to change a behavior. So instead of exposing them to something positive, we want to change the association to something more negative. So we pair something negative with the behavior that they want to change. An example of this would be if somebody's an alcoholic and they want to stop drinking, alcohol maybe makes them feel relaxed, but before they drink, they might give them a pill that makes them feel nauseous as soon as they take a drink. After pairing that enough times, the idea there is that instead of feeling relaxed, they will start to associate drinking alcohol with feeling nauseous, and therefore they will not want to do it again. So they are creating an aversion to that stimulus. So those are the different classical conditioning techniques that are used, changing the association either from something positive to something positive, which is with exposure therapy, or something negative, which is with, aversive conditioning. Got some videos on here if you want to watch them. In terms of operant conditioning, all right, the goal of operant conditioning is behavior modification. When there is an unwanted behavior, we want to change it, and we want to change it through using reinforcement. So with behavior modification, we reinforce a desired behavior, but we fail to reinforce, or we sometimes punish an undesired behavior. In a real world setting, this is called a token economy. Token economy, you earn a reward, a token, for exhibiting whatever the desired behavior is. If it is a child with autism, raising their hand instead of blurting out the answer, okay, then whenever they raise their hand, they get a reward for it. And eventually these tokens can be exchanged for some sort of privileges or treats or whatnot. This has been found to be really effective in institutional settings. If they're trying to get a schizophrenic patient to make their bed every morning, when they make their bed, they will give them a token. When they eat all their food, they will be given a token. All right. In school, when you got a gold star, and if you got a certain amount of gold stars, you were able to go and pick out a prize from the teacher's prize box. That is a token economy. In an institutional setting, it might be exchanged for, it might be able to buy something from the commissary, from the store in the institutional setting, or whatnot. So reinforcing good behavior, and then eventually they get a larger reward for once they have enough of those tokens. So that is how we go about changing behaviors. Now, the final type of therapy, the one that is used probably the most now, especially with depression, is cognitive therapy. The idea behind cognitive therapy is that in between an event and our reaction to the event, there are thoughts. How should we react to it? How should we feel about it? And a lot of times those thoughts after an event, somebody breaks up with you, those thoughts might be irrational. So the idea here is to change the process of irrational thinking between an event and a reaction. Change the cognitive process that we go through. Two people that you need to associate with cognitive therapy are Albert Ellis, who was sort of the initial person with this, with rational emotive behavioral therapy that we'll talk about more here in a sec. And then Aaron Beck. All right, Beck is known for, especially with using cognitive therapy to treat depression. And he developed one of the initial measures of depression, which is called Beck's Depression Inventory. Rational emotive behavior therapy, or REBT, with Albert Ellis, his goal was, in the end, to change our patterns of thinking by showing how absurd it is for us to think about things in a certain way. If somebody loses their job, okay, if they have what they call a stable pattern of thinking, they may believe, all right, I'm worthless, it's hopeless, I'm never going to get another job again, and that this pattern of thinking can lead to depression. Where in turn, they want to change that into, if somebody loses their job, they need their belief to change into, all right, well, even if it's not necessarily true, well, it wasn't a good fit. I deserve something better. There's value in thinking if somebody breaks up with you that, well, maybe they weren't the right person. To reframe it in a more positive manner, one that is not stable, one that is changing, and understanding that through that you can change the outcome of something by changing your pattern of thinking. By thinking that, well, that job was not the right fit, then you think, all right, well, something else is the right fit. And so they found that changing that pattern of thinking can lead to lower levels of depression. So rational emotive behavioral therapy, changing irrational beliefs about yourself and about the world into more rational beliefs. The one that is used the most often now is what is called an integrative therapy, which integrates cognitive therapy and behavioral therapy. This one assumes that how we think, our behaviors, and our emotions are all interrelated to one another. And that changing one of them might not cover everything. This was initially focused on depression, but it's been expanded into treating pretty much most other disorders, especially depressive mood and mood disorders and anxiety related disorders. So the idea here is with CBT is to change the way that you think about the world while also changing the way that you behave. The Ellis, who helped develop this as well, said that the trouble with most therapy is that it helps you feel better. You don't get better. You have to back it up with action. So changing how you think about something, it may change how you feel about it, but in the long run, okay, you're probably, if the behaviors all stay the same, if somebody is depressed and they start feeling better, but they can't get out of the cycle of staying in bed all day, well, then their depression is probably not going to get better. Um, so this has, for example, this has been found to be very effective with treating patients with OCD. Let's say that somebody has a hand washing obsession. When they start getting those obsessive thoughts, they may be told to relabel that obsessive thought as, I have germs on my hand. I need to wash my hands. I need to wash my hands. As thinking, well, I'm having an obsessive thought that is going to lead to a compulsion. And that obsessive thought is not a product of who I am, but a product of abnormal brain chemistry. So they are relabeling that obsessive thought. At the same time, instead of giving into the compulsion, they are maybe taught through some sort of behavior modification, whatnot, to instead of compulsively washing their hands for 15 minutes, force themselves to do something that they find enjoyable, like they play guitar, playing guitar, or going for a walk, or going for a run, even if it's just for 15 minutes or so. So they are changing the way that they think about that obsessive thought by understanding that it's a product of something that they can't control, that's something that is not necessarily who they are, while also changing the behavior and flipping it from obsessively washing their hands to maybe gardening for 15 minutes instead. So cognitive behavioral therapy is what, if you've gone to therapy, there's a good chance that this is the type of therapy that has been used to change not only your thought patterns, but also maladaptive behaviors that go along with that. So there's a video here. If you want to watch it with dealing with a phobia of feathers. And yeah, all right. Hope everybody has a good spring break. And I will see you all on April 13th, 12th, 13th, 14th. All right.